A new virus on the block. Understanding the basics of MPox. MPox, formerly known as Monkeypox, has recently grabbed headlines worldwide. First discovered in monkeys in 1958, this viral disease was confined to Africa for decades. A surge in cases in 2022 led the World Health Organization to declare it a public health emergency. MPox is a zoonotic disease spreading from animals to humans. Rodents are believed to be the primary animal reservoir. The virus belongs to the same family as smallpox, eradicated in 1980. Though less severe, MPox can cause significant illness and discomfort. It presents with flu-like symptoms followed by a distinctive rash. Understanding MPox, its spread and impact is crucial for prevention and control. The global community must work together to raise awareness and ensure access to diagnostics and vaccines. MPox transmission, how it spreads and who's at risk. MPox spreads through close contact with an infected person or animal, or contaminated materials. Direct contact with the MPox rash, scabs, or bodily fluids, including respiratory secretions, is a primary mode of transmission. Transmission can also occur through indirect contact with contaminated materials, such as bedding, clothing, or surfaces touched by an infected person. While airborne transmission is less common, it can happen over prolonged periods of close contact, particularly in enclosed spaces. Anyone who has close contact with an infected person or animal is at risk of contracting MPox. Healthcare workers caring for MPox patients are at higher risk due to their close proximity to the virus. Historically, MPox outbreaks have been primarily reported in Central and West Africa, often linked to contact with infected animals. However, the recent global outbreak has seen a shift in transmission patterns, with cases now reported in many countries where the virus is not endemic. Recognizing the signs and progression of MPox is crucial for early detection and preventing spread. The incubation period ranges from 5 to 21 days. Initial symptoms mimic flu-like illnesses: fever, headache, muscle aches, and swollen lymph nodes. The rash starts on the face and spreads to the palms and soles. It progresses from red spots to pus-filled bumps that scab over. Symptoms last 2 to 4 weeks, with most people recovering fully. Section 4. Diagnosis and treatment. What to expect if you suspect MPox. Diagnosing MPox involves a combination of clinical evaluation and laboratory testing. Healthcare providers consider a patient's symptoms, travel history, and potential exposure to infected individuals or animals. Visual examination of the characteristic rash often provides strong clues, but laboratory confirmation is essential for a definitive diagnosis. Testing involves collecting a sample from a lesion and sending it to a specialized laboratory for polymerase chain reaction, or PCR testing. PCR testing detects the genetic material of the MPox virus, providing a highly accurate diagnosis. Early diagnosis is crucial for initiating appropriate care, isolating infected individuals, and implementing contact tracing measures to curb further spread. While no specific treatment exists for MPox, most cases resolve on their own with supportive care. This includes rest, hydration, over-the-counter pain relievers, and medications to manage fever. Section 5. Protecting yourself and others. Prevention is key. Preventing MPox transmission requires a multi-pronged approach, encompassing individual protective measures and public health interventions. Vaccination is a crucial tool in preventing MPox infection. While the original smallpox vaccine is no longer widely available, newer vaccines like Jynneos have been developed and shown to be effective against MPox. Vaccination is recommended for individuals at high risk of exposure, including healthcare workers and close contacts of infected individuals. Practicing good hygiene is paramount in preventing MPox spread. Washing hands frequently with soap and water or using an alcohol-based hand sanitizer is essential, especially after contact with an infected person or contaminated materials. Avoiding close contact with infected individuals, including skin-to-skin contact, is crucial. Using personal protective equipment such as gloves and masks when caring for infected individuals can further reduce transmission risk. Section 6. The global fight against MPox collaboration is crucial. The recent global MPox outbreak underscores the importance of global cooperation in combating health threats. Enhanced surveillance systems are crucial for early detection and rapid response. Sharing information and best practices is essential for coordinating control efforts. Equitable access to interventions is paramount in mitigating the global impact. By working together, we can protect vulnerable populations and prevent a global health crisis.